Hello students, welcome to my class. So in this video, we'll be studying about the topic metal complexes as drugs, that is how they are used as drugs and therapeutic agents. To begin with, we are starting with what is chelation therapy. So chelation therapy is nothing but it's a medical procedure that is required to remove heavy metal from your body. So if we studied that how a person's body can get toxified by different heavy metals like lead, Pb, etc., mercury, etc., but you can also detoxify the body. For that you require something called as chelation therapy. So in chelation therapy we use chelator or chelating agents. Some of the examples for them is EDTA or dimercaprol, etc. So you know that the poison gets incorporated in the food chain. This we already studied in case of mercury. Mercury undergoing biomethylation. Then it is passing to the body of the fishes, and then those fishes are eaten by large fishes, and then goes into the body of human beings. So it undergoes that poison that is there, CH3Hg plus, it undergoes bioamplification. That is, in each of the step of food chain, it is increasing in its concentration. Okay, so it needs to be detoxified. For doing that, we use something called as chelation therapy. Let us study what are the requirements of a chelating antidote. So we are studying what are the requirements for a good chelating antidote. First is conditional stability constant. Now students, when you are taking, say there is a person who is infected, or he has high toxicity of heavy metal in his body. Okay, now he is taking a particular chelating drug to his body so that he can detoxify himself. Now that heavy metal that is present in his body is already bound to some metalloprotein or enzyme. That metalloprotein or enzyme is called as biogenic ligands. That is, that heavy metal ion in his body is already bound to some metalloprotein or enzyme and has already deactivated it. Now this chelating drug that is entering his body, what should it do? It should be able to displace that enzyme or detach that enzyme from this toxic metal, and itself has to be able to bind to that toxic metal, correct? And then it has to, only if it binds, it can bring it out of the body, correct? So that is the work that chelating drug has to do. To achieve this, the conditional stability constant between that toxic metal which is to be removed and the chelating drug which is being consumed must be greater than that of the competing bioligand involved. Means to say that they're telling that this conditional stability constant between the toxic metal and chelating drug should be much more than that between the toxic metal and the enzyme or metalloprotein which it is already bound to. Only then it will leave that bioligand and come and attach to the chelating drug, and only then it can be removed out. That's why conditional stability constant is a very important factor. Also, one more thing, they are telling that whenever a chelating drug is consumed by a person, what happens? It gets into the body, and you know that in the body there are several essential elements like calcium, zinc, iron, etc. So there is a possibility that instead of the toxic metal being attached to the chelating drug, these essential metals can also come and bind to the chelating drug. But that toxic metal should be removed, so it should be able to displace these essential metals and bind to the chelating drug. So this also happens because of the conditional stability constant. That is, conditional stability constant of that of the toxic metal and the chelating drug is much high than these metals and chelating drug. Okay, so instead of these essential metals attaching, the toxic metal will go and attach to the chelating drug. That's why the first factor is conditional stability constant. Next is lipophilicity of the chelating drug. Now, in some cases, you know that this toxic metal, example, this mercury only, biomethylated mercury, you know that it is lipophilic in nature because of the methyl group that is attached. It is lipophilic in nature. So, what can it do? It can pass or it can penetrate through the cell membrane and it can reach your brain. because of which it will get accumulated in your brain and it can lead to brain damage or brain cancer. Correct. So this chelating drug that you're giving, sending into your body, should also be able to enter the brain and remove this particular toxic metal from the brain. Correct. For that, it should also be lipophilic in nature. That is, it should also have lipophilic any lipophilic ligands attached to itself, so that it can move through this cell membrane. So in such cases, by introducing a lipophilic moiety in the chelating drug, that is, they are telling that we are adding lipophilic groups to the chelating drug so that its property becomes lipophilic, so that it can pass the membrane, that is the cell membrane, especially like organs like brain. It can pass, penetrate into the cell membrane and go and remove the toxic metal from there. One example you should know, that is, to detoxify this methylated mercury, what they're doing is they're telling that N-acetyl penicillamine is more promising than the unsubstituted penicillamine. Why is that, students? Because in N-acetyl penicillamine there is this acetyl group, correct? It is lipophilic in nature, so it is making this d-penicillamine also lipophilic in nature, because of which it can pass through the cell membrane, whereas just d-penicillamine is not lipophilic in nature because it does not have any substitutions. Next is hard and soft acids and bases. This you have already studied, that these organic metal ions and non-metals are all classified into hard and soft. So they are telling that if the toxic metal ion to be removed is hard in nature, then it would prefer a chelating drug which has hard donor sites, because the chelating drug has to go and form a complex with that toxic metal ion. No, and complex formation is easy when the ligand chelating sites are also hard in nature, and the toxic metal ion to be removed is hard, then it will prefer a donor site which is also hard in nature. Whereas if the toxic metal ion to be removed is soft, then it will prefer a donor site to form a complex which is also soft in nature. So they are telling that if the chelating drug, if the toxic metal to be removed is hard in nature, then prefer a chelating drug with hard donor sites. Whereas if the metal to be removed is soft in nature, then prefer a chelating ligand which is soft donor sites, having soft donor sites. And in the table they have given you some examples and what type of chelating ligand or chelating drug is best for removing that particular metal. If you know one example, it is more than enough. Next is designing the antidote with the binding sites mimicking the endogenous binding sites. So this is like, trying to fool the target metal, so that the toxic metal itself comes and binds to this chelating drug. So here they are telling that each toxic metal will have certain high affinity towards one particular site to go and bind. Like, that most of these toxic metals, they prefer to bind in the enzyme. There is SH sites where they prefer to replace the hydrogen and go and bind over there and form complex and deactivate the enzyme. Correct. So here they're telling that the chelating drug that we are making should look like an enzyme only, so that when it is entering the body, and this toxic metal will, they have high affinity, correct, for the enzyme, so they will think that these chelating drugs are enzyme itself and come and form a complex with it. So that is called as mimicking the endogenous binding sites. For example, in order to remove Pb2 plus, they have high affinity, or they prefer to bind to polypeptides of multidentate character. So the chelating drug you're sending inside the body should also have polypeptides of multidentate character. Same way for aspartic acid, cysteine, histidine, it should have amino acids of L configuration. They prefer to bind to amino acids of L configuration. So your chelating drug should have same thing, so that it is easy or quickly the toxic metal will bind to the chelating drug. And the last point is the toxic effect of chelating drug. Now, students, one more thing when we are taking chelating drug, one more requirement is that the drug it should not itself should not turn into poison. Correct. So they are telling that while selecting a chelating drug, you should select a favorable chelating drug which can go and do its work. That is bind to the toxic metal and get it out of the body through urine or feces. Okay, but it itself should not get accumulated in the body or should not turn toxic. Correct. So drugs which have higher value of LD50 is usually preferred as chelating drugs so that they can do their work. So one example is given, that is in detoxification of methylated mercury. If BAL is introduced as a chelating drug, it does form a complex with this toxic metal, but this complex that is formed, it can easily pass through the blood brain barrier. That is, it can cross the cell membrane of the brain and can enter the brain, and once again there will be accumulation of mercury in the brain. So you cannot use this drug in order to chelate the or detoxify methylated mercury. So usually the drugs having higher value of LD50 is preferred for chelating because they themselves, the chelating agents themselves should not turn toxic. So this is a chart of different uh, LD50 values of different drugs that is used. So the next point is that how it should be brought out of the body. That is urinary and biliary excretion. That is this particular chelating drug which is now in the body and has already trapped the toxic metal. So they're telling that if it is a water soluble type of chelating complex and if it has low molecular weight, then it can come out through urinary excretion, or if it has slightly high molecular weight and it's insoluble in water, then biliary excretion is preferred. So a chelating drug that is sent into the body that has done the work of trapping the toxic metal ion should be removed also. Correct. So two ways, that is urinary secretion or biliary excretion, is preferred. So summarizing what we have studied so far, what are the basic requirements? In just one point, we will summarize. What are the basic requirements for a chelating drug? It's a very important question. So what one thing is, it should bind to the metal sufficiently strong to compete with the endogenous biological ligands. So if that toxic metal is already bound to some particular protein or enzyme, this chelating drug should bind to this toxic metal very strongly so that this bond is broken and it won't again, toxic metal will not again free itself and go and bind to the protein. So that binding should be very strong. Next is, it should not bind to the essential metal ions that is already present in the body, because those are required by our body. So it should be able to differentiate and discriminate against these essential metal ions. It should only bind to the target molecule like toxic or heavy metal ions which are present in the body. Plus, it should be sufficiently lipophilic, that is, it should be able to enter the membrane compartments and get into the brain as well, and then should be able to remove the metal ion that is accumulated in those sites as well. And last one is, it should have a high LD50 value. Next, we are studying about two important types of chelating drug. The first one is BAL, which we came across in many places where different toxicity can be cured by BAL. So this was a drug that was developed by British scientists during the Second World War, and it was required for treating patients that were affected from poison gas, that is lewisite. Okay, so lewisite had an arsenic. It is an arsenic containing gas which does arsenic poisoning or arsenic toxicity. So you know that arsenic, it has high affinity to the SH groups of the protein. So when it gets into the body, what does it do? It replaces the SH groups of the protein and it replaces the two H groups and takes the place of the H groups like this, and there is a complex formation. So this is the complex formation of arsenic with an enzyme which initially had one H here, one H here. Those two H were removed and substituted by this arsenic which is a poison. now this enzyme has become inactive in nature because it has got its H groups have been removed and it is denatured, so it has become inactive in nature. So in order to restore this enzyme, what they're doing, this is bal that is being consumed, and you can see that it's a good chelating drug. Reason, it has this, it is mimicking that SH groups, two groups that were there in enzyme. Same way here bal also has two SH groups, so it is easy for this arsenic to form complex with these group, and that's when arsenic will leave this enzyme and enzyme will become independent. So that is shown in the reaction, that is arsenic will leave this part where that enzyme it is bound, it will leave that enzyme and form a complex with the bal. So you can see 2H replaced from the bal and arsenic has formed a complex, and as soon as bal leaves the enzyme becomes free and comes back to its active state. So this is how bal it restores the activity of the enzyme and detoxifies the body from arsenic. Now this can be easily removed out from the body, that is the arsenic bal complex is excreted through the urine, okay, and the enzyme activity is restored back. So even in cu poisoning and in Wilson's disease, bal is used, it shows antidotal activity. And bal is recommended for treatment of different heavy metal poisoning, maybe mercury, AuTl, etc. But in case of mercury, we already studied this. It forms a neutral chelate like this, and but this neutral chelate it passes through the biological membrane, so it enhances the toxicity by its redistribution. That is, it can pass through the brain, and once again there will be accumulation of this biomethylated mercury in the brain. So it is not preferred in case of mercury. This reaction happens in the body and this can once again enter the brain. So it is not preferred in case of mercury detoxification. And a few other drawbacks of bal is that it is aqueous solution and it is unstable with respect to aerial oxidation. That is, when it is exposed to outside air, it can undergo oxidation and it is an unstable species. Plus, when it has a very irritating odor smell, and when it is being injected to the patient, it is very painful. So anesthesia should be given while the patient is injected with bath. So hence it is not a very good chelating drug because it has several drawbacks. So next is D-penicillamine. D-penicillamine, it is 3-mercaptogene, and its D isomer is active but L isomer is toxic. So this happens many times that one isomer will be active and will act as drug, whereas one more isomer will be actually toxic to the body. So this is a D isomer which is used as a drug. You should know to draw the structure of BAL as well as D-penicillamine. And so why is it so active is that it has binding sites like sulfur, nitrogen, oxygen. Can you see there is sulfur binding site, there is nitrogen here, there is oxygen. So these binding sites they can bind with heavy metals like Hg, copper, lead, etc. And it also has high LD50 value, that is much higher than BAL. And you know that higher the LD50 value, good the better the chelating ligand, and it can be orally consumed. And this is NAPA, that is penicillamine, which has an extra acetyl group in it. And because of the presence of this acetyl group, that is a substitution on the penicillamine, it makes it lipophilic in nature. Why should it be lipophilic? We already studied, in order to move through the cell membrane, especially in organs like brain, in order to enter the brain and move through the cell membrane, the drug should be lipophilic in nature. So this acetyl group that is present along with the DPA makes it lipophilic in nature. So this is more effective and it can effectively remove mercury toxification from our body compared to that of DPA. And Sometimes one drawback is there that during the therapy, that is DPA therapy, there is possibility of depletion of essential elements like zinc and copper. This you know that sometimes when the chelating drug enters into the body, instead of removing the toxic metal or along with removing the toxic metal, it can also remove some essential metals also from the body. This is seen in case of penicillamine, that is it might remove zinc and copper as well. So this is indicated by loss of taste sensitivity. The person who is on this drug will have might suffer from CU depletion and might eventually lose taste, but this can be overcome by taking copper salts orally. Next is what are the limitations of chelating therapy that is being used. One is these chelating drugs that the person is consuming can give some symptoms or side effects, like the patient might suffer from diarrhea, skin rash, vomiting, or in the place where this chelating drug is being injected, there that person might have irritation. And you know that because of this chelating drug, excess of the toxic metal comes out of the body through urine, but before coming it has to go to the kidney, correct? So what happens there in the kidney, the concentration of this toxic metal increases to a larger extent. So the burden on the kidney is increased because their kidney, the purification takes place and there is excess metal getting going into the kidney in order to be removed out through urine. So the burden on the kidney is increased because of the kidney function might get impaired. Okay, and also if because if a person is having like long term chelation therapy, going through long term chelation therapy, that person might be suffering from depletion of essential metal ions. You know that chelation therapy, some chelants they can, along with the toxic metal, they can also remove essential metals from the body like zinc, calcium, etc. So for a person who is going for this therapy for a very long time, might be depleted with these essential elements. And also you know that these essential elements are required in the body for different biochemical processes to take place. So that person might have different biochemical processes in its body might be impaired, in that particular patient's body might be impaired, and different biochemical processes might not function that well because of the lack of essential metals. And then in case of pregnant animals, what happens if that pregnant mother is undergoing chelation therapy for a very long time, then the baby can suffer tetragenic effects, that is the baby or the developing embryo and the baby that will come will have some kind of defects, majorly physical defects, like might be a handicap. Also, this congenital malfunction arises why? Majorly due to the deficiency of essential elements, because you know that for the growth and development of an embryo, major requirement is all these essential metal ions. But if they are depleted from the body, especially zinc, then that baby might suffer physical disablements. Okay, and last thing is, it might also, chelating drugs may induce the undesirable translocation of metal complexes to enhance toxicity. That is, instead of removing these heavy metals from the body, they might translocate them to some other organ, or that is best understood in the case of detoxification of biomethylated mercury with BAL. You know that once it forms a complex, it can penetrate to the brain, and that can lead to once again accumulation of mercury in the brain. So there is undesirable translocation of metal complex happening. So these are some of the drawbacks that is suffered if the patient is undergoing chelation therapy. Next, we are studying about another important concept, that is anti-cancer activity of platinum complex. How platinum complexes are useful for treating cancer. So it was found out in the late 1960s that platinum complex, that is only the cis complex of platinum, can be used for treating cancer. It was accidentally discovered, and it was found that the cis isomers of platinum, cis complexes of platinum, they are very, very good in treating cancer. So there are several complexes that are given. Those are all cis complexes like PTNH3 twice X2 or PTENX2 twice, etc. etc. These are all, they were good at showing anti-cancer property. And here this NH3 group that is there, ammonia group, it can be replaced by different amines, depending upon what is preferable. Different substitutions can be done at the NH3 group, like you can displace it with methylamine. These are all allylic forms of amine, or you can use cyclic forms like cyclopropylamine or cyclobutylamine, etc. But it was found that in the complexes where the NH3 groups were replaced by alicyclic amines like cyclobutylamine or cyclopropylamine, they had high LD50 value. Now you know that for a very good chelating drug, it should have high LD50 value, correct? So NH3 group that were substituted by alicyclic amines were very good anti-cancer drug, but their ID50 value was as same as that of any other group, like any group having NH3 or any group in which any complex in which NH3 is removed and substituted by an alicyclic amine, the LD50 value increased, but the ID50 value was almost the same. And the therapeutic index, that is the ratio of LD50 by ID90, in case of alicyclic complexes, it was much higher. Alicyclic enzyme, the NH3 groups are replaced by some alicyclic groups like cyclo groups. Okay, so it had higher TI, that is therapeutic index value, which is a good thing. It is telling us that it is a good drug, but the only disadvantage of this complex was that it had low solubility. If it does not have good solubility, then it cannot be administered into the body easily, and it will not go and incorporate in the body easily. So solubility is an important factor. Only that disadvantage of this drug is that is it had low, the alicyclic complexes is that they had low solubility. So because of which their clinical use was hindered. Okay, and it is also one thing you have to note that the cis form of platinum is active, whereas the trans form is inactive as well as toxic. This we told earlier also. Some drugs, their cis form will be active and very good, whereas the trans form will be toxic in nature. So in this case also, the cis form here is active, whereas the trans form is inactive and toxic. Okay, and the cisplatinate, it is effective, or cisplatin it is called. It is effective for treating various cancers, especially testicular and ovarian tumors, and it is one of the top 3 anti-cancer drugs that is used throughout the world. So these are some of the examples of cis forms of platinum complexes which are used as anti-cancer drugs, and these are the two major ones, that is cisplatin and carboplatin. These two structures are important, you need to know them. So widely used among all these is one is cisplatin and carboplatin. Major reason is that these two, they have least toxicity in the body. That is, some chelating drugs, they can show toxic effects in the body also, correct? The drug itself might have some drawbacks, like it might cause irritation or different diarrhea or other problems in the body. So these two are showing least problems or least toxicity in the body, so these two are widely used. So what are the property a platinum containing complex requires to be an anti-cancer drug? One is the compound should be neutral, because it should pass through the cells, correct? Because cancer means the DNA itself will be affected, so it should get into the cell and treat that DNA, correct? So for that to happen, it should be neutral in nature. That is one requirement. Second thing is, it should definitely have a cis configuration, because you know that the complex of platinum having trans configurations are actually toxic to the body, so they should definitely have cis configuration. And the non-living group should have poor trans labelizing power, and they should be amines. Here, what are the non-living groups here, students? Those are the NH3 groups here. Can you see NH3 groups or NH2 groups that are present? So all the amine groups that are present, they are the non-living groups. And other chlorine groups are all living groups. So these two, that is non-living groups, should definitely be amines, and they should have poor translabilizing power. Okay, and out of the complexes, the cisplatin as well as the carboplatin, they are widely approved for clinical use worldwide, and they are used, and the rest of them are not much used clinically, that is the oxaloplatin or seroplatin, because of their increased high risk of toxicity. They are not much used, as they are not as popular as cisplatin and carboplatin. Okay, and the toxicity of the second generation anti cancer drugs, that is these two, cisplatin and carboplatin, their toxicity is relatively less, that is they won't have much side effects in your body if you consume them. And their dosage limit is, for cisplatin, maximum allowable dose is 100 milligram per day, and for carboplatin it is 2000 milligram per day. Okay, but they are effective only to only few types of cancer. There's wide range of cancers, but these drugs are effective to only certain types of cancer. And because of high toxicity and side effects of other complexes, they have not been used. They have been abandoned, and they are not used anywhere for cancer treatment because they show high side effects. And it should be noted, one more point to remember is that it is not just the neutral platinum complexes that show our anti-cancer activity. The charged complex, that is the complexes having charge in them, even those charged platinum complexes, these are called as platinum pyrimidine blues, they also show anti-cancer properties in them. Some of the examples are given. So next is the toxic effects of anti-cancer platinum complexes. So you know that platinum, you study that platinum are good for treatment of cancer, but you know that every drug, it comes with certain side effects. Same way platinum also will have certain side effects, and biologically our body does not have effective mechanism to cope up with the toxicity of platinum. So one thing why this toxicity might be caused is because platinum being soft, it will interact with heavy metals that is present in the body. That can happen. And also, you know that soft metals, they interact with the soft binding sites like SH, NH2 groups of different enzymes. So they bind, they replace the H and bind there, and then they deactivate the enzyme. So platinum might also do this, that is they can interact with the SH, NH2 groups of different enzyme. And but the toxicity depends upon what type of amine groups or acidoligands are present in the platinum complex. And major toxic effect related by consuming cisplatin, by cisplatin treatment, is it includes nephrotoxicity, that is kidney damage might occur, because this platinum groups might interact with the SH groups of the enzyme present in the kidney, might replace the H and take its position, because of which the enzyme might get deactivated. So kidney disease, that is nephrotoxicity, might happen because of uh, a toxic effect of cisplatin. But this can also be controlled by taking large amount of water. Okay, by hydration, that is called as hydration therapy, that will flush out this metal complex from the kidney and remove the kidney toxicity or bring down the kidney toxicity. Also, you know that it is expected that SH groups of the enzyme can be protected in one more way, that is competitive, by using competitive rescue agents. These agents, what will they do? They will bind to the platinum before it goes and binds to the SH groups of the enzyme. So these are competitive rescue agents. So there are different ways in which toxicity can be controlled and platinum can still be used. and different symptoms like nausea, vomiting, etc., they can be controlled by taking antiemetic agents. Okay, so there are toxic effects or drawbacks of this platinum therapy, but it can be controlled by different ways. Next is we are studying how the mechanism of cisplatin, how it interacts and how it acts as an anti-cancer agent. So one thing you have to know, students, here cisplatin, its main target site is DNA, because in cancer what happens actually, there is a mutation of gene. Okay, so it is actually affecting the DNA, correct? That disease, cancer. So cisplatin's main target site is to repair this DNA. That is, it attacks on the DNA bases to destroy the double helix structure of the DNA, so that that DNA which is affected will not get replicated further. Okay, so cisplatin, it interacts with the DNA bases, but in order to interact with the DNA bases, it should undergo hydrolysis, or it should hydrolyze. Where should it hydrolyze? Now you know that cisplatin, it will be given through your veins, so it will move through your blood and then it will enter the cell, correct, through the passive diffusion. It will enter through the membrane of the cell. Now cisplatin should not hydrolyze in the blood, it should only hydrolyze once it has entered the cell. This point is very important, students, understand. Cisplatin that is given through your blood, injected through your blood, where should it, its target site is DNA. Where is DNA present? Inside the cell. So cisplatin should undergo hydrolysis only inside the cell, not outside. In case it undergoes hydrolysis outside the cell, that is in the blood, then it will not perform its required activity. So this, how is this happening? Why does cisplatin does not undergo hydrolysis in the blood? Is because in blood the Cl minus concentration is very very high. Okay, so cisplatin, this is cisplatin. See, here in the blood, the Cl minus concentration is very, very high. So these two sites are the ones that undergo hydrolysis. Okay, the Cl parts are the replaceable parts. They are replaced by water molecule. So in the blood, where the Cl minus concentration is very, very high or fairly high, this because of this reason, that is concentration of Cl minus is high in the blood, it will not undergo hydrolysis in the blood. Whereas once it enters the cell membrane, it undergoes hydrolysis in the cytoplasm. What is the reason? Because inside the cell the concentration of Cl minus is very low. So it is the concentration of Cl minus that is controlling the hydrolysis of cisplatin. In order for cisplatin to work properly, it should undergo hydrolysis where? Only inside the cytoplasm of the cell. This happens how? Outside it will not undergo hydrolysis because concentration of Cl minus is high. Inside it will undergo hydrolysis because Cl minus concentration is low. And then after hydrolysis, the hydrolyzed products, they are activated. Now cisplatin in the hydrolyzed form, it is activated and then it interacts with the DNA in order to cure cancer. So this is a mechanism that they are showing. This is cisplatin that is entering your blood, which is there in your blood, where Cl minus concentration is high, and the distance between the two Cl groups of the cisplatin is 300 picometer. And then here it will not undergo hydrolysis, then it will enter through the to the cell membrane, where now it is in the cytoplasm of the cell where the Cl minus concentration is low. So what will it undergo? It will undergo hydrolysis, and this is first one group will be replaced by H2O molecule. Second, one more time it will undergo hydrolysis and two groups will be replaced by water molecule. So this is the activated form of cisplatin. That is, it can then it will lose one H plus ion. So these three are the activated forms of cisplatin which will then interact with the DNA in order to cure cancer. Okay. Next is mode of binding, that is how does the platinum bind to the DNA. That is, there are different ways in which DNA bases can bind, the platinum can bind to the DNA bases. You know that DNA has purines and pyrimidines, correct? You have studied in your bio classes that it has purines that are adenine, guanine, etc., and pyrimidines are there like cytosine, etc. Okay, so how does this binding of this activated form of cisplatin to the DNA strand takes place is that it can occur in different ways, that is intra-strand linking. So in intra-strand linking, the platinum binds to two adjacent guanine bases of a single DNA change. Or in one more way, the platinum center may bind to adjacent guanine and adenine base. Or intrastrand cross linking, here platinum bridges with the DNA bases of opposite strand. Here only single strand, here it links with the opposite strand. Or a didentate chelation, that is it binds to only one single base like guanine. Okay, so that two bonds with the single base, that is gone. And out of the purines, this platinum prefers to bind to guanine and adenine, and out of the pyrimidine, it prefers to bind to the cytosine. Now, next, let us study how this repairing mechanism, DNA repairing, takes place. So step number one is this is a DNA strand, students, and this is your cisplatin which is supposed to bind to this DNA strand. Step number one is the bite-sized distance between the two cis ligands in the cisplatin is 300 picometer. So we have already, I have shown you in the structure that the distance between the two chlorine atoms of the cisplatin is 300 picometer. That's what they are telling here. It is 300 picometer, and same way which can be maintained by the adjacent DNA bases like guanine. Here can you see G and G? These two are the guanine bases of the DNA. So this distance between the two chlorine of the cisplatinate is also 300 picometer, and this distance between the two guanines of the DNA chain is also 300 picometer. Because of these two distances are matching, this matching between the geometrical parameters of cisplatin and DNA structure, it favors the interaction, that is two chlorine will be lost and that full part will go and attach to these two guanine, because this distance is same. Guanine also, this distance is 300 picometer, and cisplatin's distance between the two chlorine atom is also 300 picometer. So they are geometrically, there is a matching in the geometric parameters, so binding becomes easy. Whereas transplatin, you know that transplatin does not perform anti-cancer activity and it is inactive. And the distance in case of transplatin, the distance between the two chlorine is 400 picometer, which is too long for coordination. That is also one reason why it is not performing anti-cancer activity, because here in case of transplatin, what happens, the difference between the two the distance between the two chlorine atoms of the transplatin molecule is 400 picometer, which is two more. So one can bind here, whereas one will come somewhere over here, it cannot form a binding here. Okay, so because of that, it is not used as anti-cancer agent. This is step number one, binding. So they're telling that out of the different routes that are available, this is the most preferred route for DNA to interact with the cisplatin. That is, this route involves the intrastrand cross-linking between the two adjacent guanines from a single DNA strand. So this is a single DNA strand having two adjacent guanine, and there is a cisplatin molecule coming to attack, and it will come and form a linkage over here with that single strand only. With this strand, it is not forming any linkage. Only with this strand, it will link over here. So this is the linked form. This is the most preferable way of cisplatin. For any cisplatin to function, first what it has to do, it has to link and attach to the DNA. Correct. This is the most preferred method for it to link to the DNA because it is easy. One is because the geometry is same, 300 picometer. So this complex that is formed, that is this final chain wherein one strand is linked with the DNA, that complex can be represented like this, wherein the P here, this P is there, no, it stands for phosphate, okay. And there is NH3 groups, correct? Can you see this? There are NH3 groups here. These groups, they are not simply present, they are involved in hydrogen bonding. So they're telling us that this is NH3 ligands participate in hydrogen interaction or hydrogen bonding with the terminal phosphate groups and exocyclic guanine. That is, you can see there is guanine also present here. So the exocyclic guanine and it forms hydrogen bonding with those groups. One more method of interaction, that is adjacent adenine and guanine base may also bind with the platinum site. So here we are binding only to two guanine bases. Adjacent adenine and guanine same way. This platinum will be over here. This adjacent adenine and guanine they bind, okay, instead of binding to two guanine. That type of interaction is also, it is same like how this is. The only difference is there two in the first thing two guanines are binding. Here adenine and guanine is binding. So these two are the most type of interaction. 90% of cisplatinate DNA interaction is of this type. Rest 1% is very less it is seen. That is interaction that is seen, that is intrastrand cross linking. That is very very less because it is little complicated. So only these two types of interactions will be seen in 90% of the cases. So what happens once this platinum complex binds? So the coordination of DNA base to the platinum center, it interferes with the ability of the ligating base to undergo Watson-Crick base pairing. So once this has interacted with this single strand of DNA, the base pairing cannot takes place to this DNA. So that DNA cannot function normally because base pairing is one of its Watson-Crick base pairing is one of DNA's function, correct? So it cannot function, it cannot undergo Watson-Crick base pairing. Hence, that DNA will not be stable in structure because for a DNA to stabilize, there should be Watson-Crick base pairing to stabilize the double helical structure of the DNA. What is base pairing, students? Pairing between these two strands of DNA. Okay, that is called as base pairing. Now, because one strand here is disturbed or distracted by binding of this platinum complex, this cannot undergo pairing with this strand, because of which its structure is not stable, correct? And then because of that, unwinding and bending of the DNA at the site of platination takes place. So okay, you can see here in the structure, this is where the DNA has like undergone platination. So here you can see the DNA has got a bent structure. Usually how it will be like, you know, like this. You have seen DNA structure, correct? Straight like that. There won't be like bent structure, but here the structure will be, and this two chains of the DNA will be winded to each other. This chain will get unwinded because of this coming and attaching here, and bent structure will be seen. Okay, and it may be noted that platination at the adjacent DNA base tend to unwind. Unwinding takes place at like 13 degrees. Okay, so you can see that 113 degree of shift is seen and unwinding is seen of 13 degrees. Okay, and last thing what happens is that due to the intrastrand cross linking of adjacent guanine bases or adjacent bases, the DNA structure, because of this platination, it becomes bent at the site of platination, and the kink angle or the bent angle, it is around 32 to 34 degree. Okay, and unwinding takes place at around 13-degree angle, and this bent angle is around 32 to 34 degree. Now, what is the use of bending this DNA is that the bending gives a different shape to the DNA than how it was before. Its shape will completely change, and because of this, the bending prevents the DNA polymerase enzyme. What does DNA polymerase enzyme do, students? It replicates the DNA, that is produces different copies, replication, that is called as replication of DNA. It stops the replication of DNA, because for replication it should be like the two strands of the DNA should be like parallel chain. But here what is happening? The intra-strand cross-linking changes the angle between the planes of the nucleobases, which remain parallel before platination. So what and all is changing? It is coming and linking to one of the strand, because of which unwinding of the strand takes place, and between the two strands the angle changes, that is 13 degree of angle changes, the DNA gets a bent structure, and with the kink angle of around 32 to 34 degree. And main thing, the what is the result of bending of this DNA is that the replication of DNA, because of DNA polymerase enzyme, will not take place. DNA replication will completely stop, because for DNA replication to take place, the DNA should have a straight structure with two parallel strands, but that is not the case in this DNA, because it is bent because of this complex. So replication will completely stop. This is the main target what we wanted, because this is a DNA that is incorporated with cancer, cancer mutated DNA. Okay, so we do not want it to replicate further. That is, we do not want replicating further means cancer spreading further. We do not want that to happen. So what will cisplatin do? It will go and attach to that DNA and stop its replication completely. Next, last step, it was also seen that some of the cellular protein, they bind specifically to the site of cisplatin DNA adduct. These proteins, they are called as structure specific recognition protein. Okay, so you can see here, this is that protein, that those protein are found to come and bind to this adduct. What do they do? What do they do? They can protect the cisplatin DNA lesion from repair. That is, the DNA, when it undergoes this bent structure, it will try to repair itself and it will try to remove this cisplatin group. But what does this protein that is coming and binding doing? It will prevent this DNA from getting repaired. Once it gets repaired, it will once again start undergoing replication, correct? So that is stopped by this protein complex that is coming and binding over here. That is, it is trying to help this cisplatin in doing its work. Hence, it facilitates the anti-cancer activity. So this is how this cisplatin. So although there is this protein which is helping to prevent, this DNA from getting repaired, but still our DNA, in our body, this DNA repair mechanism is very sophisticated. That is, it is much more stronger than that. So this DNA will once again, it will try to repair itself by removing that platinum kink, okay, by trying to straighten itself. But what does this platinum kink or platinum cisplatin do is that it blocks the DNA damage recognition protein. Before the DNA can recognize where the damage is done, that protein itself is being blocked by cisplatin. That is how it tries to break the DNA like that, and form a kink. So the DNA cannot self repair itself. Actually, this mechanism, that is self repairing of DNA in our body, is very very strong. It will, as soon as this cisplatin goes and sits there and forms a kink, it will try to get back the DNA to its original form. But cisplatin also, it blocks the damage recognition protein, and hence it is difficult for it to repair. But nature, it develops resistance against the cisplatin drug, because according to the nature, it actually thinks that cisplatin is harming the DNA, correct? Because it is twisting it. But actually what is happening, it is a actually cancer infected one, so it is actually doing a good thing, but nature shows resistance to it. How does it do that? It increases the concentration of SH group containing species like glutathione. And you know that whenever there is high concentration of SH group containing species, they will form the platinum centers, they will form complex with this group by replacing the H. So instead of the platinum centers going and binding to the DNA bases, they will bind with this SH group. That is, they are trapped in this SH groups and hence they cannot function. This is how nature shows resistance against this cisplatin drug. Next, another important aspect is, why are we taking only cisplatin? Why trans form cannot be used? Why is it toxic in nature? Now, students, trans isomer, it is kinetically more labile. That means that the Cl groups present in it can be quickly replaced, or the can be quickly exchanged to any nucleophile present in the body, such as nucleophiles coming from amino acid residues, or any other residues. So you know that in our body bloodstream there will be different amino acids, proteins, etc. The Cl minus group of the trans isomer can be replaced by any other amino group, because of which they are not going to their target site. Which is their target site? The target site is a DNA. They should go there, and there the exchange of the Cl groups should take place, correct? But in case of cis, what happens? They can be exchanged because they are highly labile in nature, more labile. They can be quickly replaced by any other ions, and that's why any other nucleophile, that's why they are more toxic in nature, whereas cis, they are less labile in nature. That is the reason they are they will not be exchanged by any other nucleophile. That is, they will, substitution is seen only by the target molecule. Okay, so the transform is not used. One more reason is the geometry. Like we said, it is 300 picometer in case of cis, which is perfect to go and bind to the two adjacent guanine centers, whereas in case of transform it is 400 picometer. So going approaching direction is also, cis goes in cis direction, whereas trans goes in trans direction. So in order to form a bond with the DNA strand, it is very difficult for transplatin compared to that of cisplatin. That is the second reason. Third reason is trans isomer, it cannot block this damage recognition protein. That is, cis, you know that it, what will it do? It will first block the DNA damage recognition protein, so that the damage is not repaired. But trans cannot do that. It cannot effectively block the DNA damage repaired protein. Hence, if it cannot block, what happens? The damage will be repaired. Whatever damage is done will be repaired, and DNA replication will start again. But cis can block it effectively, so damage repair will not take place. That's why trans is not used and cis is preferred. So that was about platinum complexes in the treatment of cancer. Next, we are studying about how vanadium complex they are used to treat diabetes. Okay. So first we'll understand why is diabetes caused actually. So the hormone insulin, it is required for the metabolism of carbohydrates and fats in our body. Okay, and this hormone, it is secreted by our pancreas, because if the blood glucose level increases, that is, glucose is nothing but this carbohydrates and fats, if the sugar level in the blood increases, in order to metabolize that, our pancreas, it secretes this insulin. Okay, and what happens if there is deficiency of insulin, or enough insulin is not secreted in our body? Deficiency of insulin, so the deficiency of insulin, it will cause diabetes. What are the two types of diabetes? Type 1 diabetes, it is called as insulin dependent diabetes. Here the pancreas does not secrete enough insulin. Okay, so insulin, it is required for metabolism of carbohydrates and fats. Because pancreas are not secreting enough insulin, it is called as insulin dependent diabetes. Okay, and for such a person, regular injections of insulin needs to be given. And there's one more type of diabetes which is seen in 90% cases, wherein pancreas, they secrete insulin, but the cell is not able to take up this insulin. So cellular response is impaired. So this is called as hyperglycemia. Okay. So this is type 2 diabetes. In both cases, the patient needs treatment, that is exogenous insulin is given. Now we are seeing how is vanadium helping to treat insulin. Sorry, diabetes. So, how does vanadium fulfill this insulin shortage in the body? So, vanadium compounds, they can be called as mimetic agents of insulin. That is, it can mimic the action of insulin. What work insulin is doing, that work can be done by vanadium compounds. So, they are known to duplicate the role of signaling hormone, that is insulin, that is required for glucose metabolism. Some examples you have to know here, that is sodium orthovanadate or vanadilyl sulfate, or even chelates like bis oxyvanadium, uh, all of these, they are used to mimic the action of insulin. So these compounds, they cannot substitute insulin. It's not like a substitute for this hormone has been found, but what they can do is they can perform the activity of insulin to a certain extent. So these are called as insulin mimetic agent. Okay, it may be noted that though insulin is not orally active, that is, you cannot give insulin orally, but these vanadium compounds, they can be given to the patient orally. That is, patient suffering from diabetes can orally consume this in the form of pills or syrup, etc. So this is one of the advantage of vanadium compounds. So there's a lot of future for this vanadium compound. This is one of the vanadium compound that is administered orally, and these vanadium compound may be appear to be a potential insulin mimetic agents in the treatment of diabetes. Okay. So in this mechanism, how this vanadium works is not clearly understood, but they are believing that this hormone, this insulin, no, how it works is that it binds to the receptor site to initiate phosphorylation and dephosphorylation. And these are the two steps in the glucose metabolism, correct? So it is said that some of these steps may be performed by this vanadium complex also. So it also might have bounded to the receptor side, and it can perform phosphorylation and dephosphorylation for the glucose metabolism. So it can substitute insulin. So the last topic is antiviral property that is shown by metal complexes. These metal complexes, they show different antibacterial, antiviral, antimicrobial activities also. So we will be discussing about antimicrobial activities in our next video. Here we will talk about some of the antiviral activities that are shown by these metal complexes. So this is shown by polynuclear transition metal oxoanions. They can be called as POMs. Okay, they show anti-cancer, antiviral, and antibacterial activity. And the anti-HIV activity stems. What do they do? By binding of this anionic POM to the viral envelope of the glycoprotein. Okay, so these POMs, they bind to the envelope of the glycoprotein. So what happens because of their binding? The negative charge on the POMs, they shield the charged sites of the glycoproteins where the virus will come and attach. So that part of the glycoprotein where the virus will come and attach, that part is shielded by the attachment of this POM. So what is this? These POMs, they can effectively, they are found effective in the management of HIV infection, that is spreading of HIV through sexual transmission, because what are they doing? They prevent the entry of this virus into the cells, correct? And so they are blocking HIV infection through both virus to cell and cell to cell contact. So they're not letting the virus to come and attack or enter into the cell. Also, they're not letting this spread from one cell to other cell to cell contact. That is one example, that is POMs. One more is oxotungstates, that is also showing an effect. It enhances the effect of one of the antibiotics, that is beta lactam, on this strain of bacteria, that is S. aureus. By what? How do they do that? This antibiotic is used against this bacteria, that is S. aureus, and this activity of this antibiotic is further enhanced by polyoxotungstates. Okay, this is one more viral property which has tungsten, antiviral property which has tungsten in this complex. Okay, so what does it do? It prevents, it depresses the formation of the essential protein which is required for the cell wall construction of this virus. Okay, so that virus cannot construct its cell wall because of this antibiotic along with polyoxotungstate. It also depresses the production of beta lactamase, which hydrolyzes this antibiotic. So it will make sure that the antibiotic which is used, which is supplied into the body, also does not undergo hydrolysis. Last example is macrocyclic bicyclams, that is ligands such as AMD 3100. This is a structure, you need to know the structure of AMD 3100. Now, what is its function? Once again, in the prevention of HIV. Okay, so it targets the early stages of retrovirus replicative cycle. It will make sure that that virus cannot undergo replication, and it blocks the entry of this virus into the cell by interacting with the 7 helix transmembrane. So these are the three examples that are used in treating HIV as well as other disease, that is antiviral activity. So with this, I will end this video. Thank you for attending my class. Take care and bye.